An elderly client is admitted with chronic obstructive pulmonary disease (COPD) exacerbation. Pulse oximetry is 84% on room air. The client is restless, has expiratory wheezing and a productive cough, and is using his accessory muscles to breathe. Which prescription should the nurse question? 1. Albuterol to 0.5 milligrams by nebulizer. 2. Intravenous for methylprednisone, 125 milligrams now and every 6 hours. 3. IV morphine to milligrams now and may repeat every 2 hours. 4. Oxygen at 2 liters per minute by nasal cannula. Correct 3. This client has exacerbation wheezing of chronic obstructive pulmonary disease. Restlessness is an early, subtle sign of hypoxemia. Although morphine can be used to decrease restlessness and slow the respiratory rate to decrease oxygen demand, it can depress respirations. Morphine and other medications that can depress the respiratory center should not be used in clients with COPD exacerbation, as they can further worsen CO2 retention. The nurse is assisting the healthcare provider HCP with the client's chest tube removal. Just as the HCP prepares to pull the chest tube, what instructions should the nurse give the client? 1. Breathe as you normally would. 2. Inhale and exhale slowly. 3. Take a breath in, hold it, and bear down. Double quotes, comma 4. Double quotes. Take rapid shallow breaths, similar to panting. Correct 3. Chest tubes are indicated to drain air or fluid from the pleural space and reestablish negative pressure, which allows for proper lung expansion. When the lung has re-expanded or fluid drainage is no longer needed, the chest tube can be discontinued. The client should be given an analgesic 30 to 60 minutes prior to the procedure. A suture removal kit, petroleum gauze, and occlusive dressing supplies will be needed. A nursing diagnosis of ineffective airway clearance related to pain is identified for a client who had open abdominal surgery 2 days ago. Which intervention should the nurse implement first? 1. Administer prescribed analgesic medication for incisional pain to encourage use of incentive spirometer every 2 hours while awake. 3. Offer an additional pillow to splint the incision while coughing. 4. Promote increased oral fluid intake. Correct 1. Postoperative clients are at risk for atelectasis and possibly for pneumonia following surgery as a result of retained secretions. Effective coughing is essential to prevent these complications. The nurse can promote many client actions that will facilitate effective coughing. These include splinting the incision while coughing, changing position every 1 to 2 hours, ambulating early, using an incentive spirometer, and hydrating adequately to thin the secretions. The nurse provides instruction to a community group about lung cancer prevention, health promotion, and smoking cessation. Which statement made by a member of the group indicates the need for further instruction? 1. Even though I am getting nicotine in my patches, I am not being exposed to all of the other toxic stuff in cigarettes. 2. I can't get lung cancer because I don't smoke. 3. My husband needs to take smoking cessation classes. 4. We installed a radon detector in our home. Correct 2. Smoking is responsible for 80% to 90% of all lung cancers. Although the risk is greater among smokers, former smokers and non-smokers can develop lung cancer as well. Risk factors include secondhand smoke, air pollution, genetic predisposition, and exposure to radon, asbestos, and chemicals in the workplace. The nurse is assessing a client an hour after a left lung lobectomy. The client is awake, alert, and oriented, and reports pain of 6 on a 0 to 10 scale. Pulse oximetry is 92% on for L oxygen via nasal cannula. The chest tube is set to continuous water seal suction at minus 20 centimeters H2O. The collection chamber has accumulated 320 milliliters of frank red drainage in the last hour. What is the priority nursing action? 1. Clamp the chest tube immediately. 2. Increase oxygen to 6L via nasal cannula. 3. Medicate client for pain and document the findings. 4. Notify the healthcare provider immediately. Correct 4. Following lung surgery, a chest tube is inserted into the pleural space to create a negative vacuum to reinflate the lung and prevent air from re-entering the space. A client with a chest tube should be assessed for signs of air, fluid in the chest excessive, drainage greater than 100 milliliters, HR, pain, and infection at the drainage site. The collection chamber should be inspected every hour for the first 8 hours following surgery, then every 8 hours until it is removed. The nurse assesses these symptoms in a client with bacterial pneumonia, chills, elevated temperature, tachypnea, productive cough of yellow sputum, shortness of breath, and fatigue. Based on the assessment data, what is the most appropriate nursing diagnosis, ND, for this client? 1. Impaired gas exchange. 2. Impaired spontaneous ventilation. 3. Ineffective breathing pattern. 4. Risk for infection. Correct 1. Impaired gas exchange is a deficit in oxygenation and or elimination of carbon dioxide at the alveolar capillary membrane. Impaired gas exchange related to a bacterial infectious process as evidenced by shortness of breath and tachypnea is inappropriate ND for a client with pneumococcal pneumonia. The nurse caring for a client with left lobar pneumonia responds to an alarm from the continuous pulse oximeter. The client is short of breath with an oxygen saturation of 78%. After applying oxygen, the nurse should place the client in which positions to improve oxygenation? 1. Left lateral, 2. Right lateral, 3. Supine, 4. Trendlenburg. Correct 2. Pneumonia is a lung infection resulting in decreased gas exchange in the affected lung lobes. The alveoli in the affected lobes become blocked with purulent fluid, which impairs ventilation. However, these alveoli continue to receive perfusion from the pulmonary artery, resulting in poorly oxygenated or deoxygenated blood. This ventilation to perfusion VQ mismatch or pulmonary shunt may result in hypoxia and respiratory distress. A hospitalized client with a history of obstructive sleep apnea sleeps while wearing a full face mask with continuous positive airway pressure CPAP. Oxygen saturation drops to 85% during the night. What is the nurse's first action? 1. Assess level of consciousness and lung sounds, to check the tightness of the straps and mask, 3. Notify the healthcare provider immediately. 4. Remove the mask and administer supplemental oxygen. Correct 2. Obstructive sleep apnea OSA is a chronic condition that involves the relaxation of pharyngeal muscles during sleep. The resulting upper airway obstruction, with multiple events of apnea and shallow breathing, leads to hypoxemia and hypercapnia. CPAP is an effective treatment for OSA. It involves using a nasal or full face mask that delivers positive pressure to the upper airway to keep it open during sleep. An obese 85-year-old client who is an avid gardener and eats only homegrown fruits, legumes, and vegetables is admitted to the hospital with pneumonia after having an upper respiratory tract infection for a week. Which factor puts the client at greatest risk for developing pneumonia? 1. Advanced age, 2. Environmental exposure, 3. Nutritional deficit, 4. Obesity. Correct 1. Pneumonia is an inflammatory process in the alveoli and interstitium of the lung, usually caused by an infectious or non-infectious agent. Any condition, such as advanced age greater than 65, that compromises the respiratory system's protective mechanical or immune mechanisms to maintain the sterility of the lower airway, can increase the risk for pneumonia.